Hi everybody. Today I would like to introduce you a clinical case of a 43 years old woman that her menstruation stopped for 2 months. When she checked it with her doctor and they did a blood test, they saw that her FSH was above 70 and her estradiol level was 100, which is low. This emphasized that the communication of the pituitary and the ovary is blocked. The ovaries did not respond to her pituitary. That is why her menses stopped and she didn't have any period for 2 months. She had a very high stress. A few months before that, she was heartbroken. And I must say that when the menses disappear for a few months, we really need to think about the feeling of this lady and ask if she had any heartbroken issues or a lot of stress. Sometimes it is related to irregular menses. Usually the menses were regular every month. Her bleeding before was around 4 or 5 days of bleeding. In the family, they didn't have any problems of irregular menses. Her mother was stable, was regular. And when I saw the tongue, I saw it is a red tongue and it has some cracks in the middle area, which is the stomach, and her tip, the edge of the tongue, was very red. The pulse was deep. So I also asked for the digestive tract. This was okay. There was no problem in that. So I diagnosed her as a kidney yin and a liver qi stagnation with heart shen imbalance. And I gave her herbs. I asked her to cook herbs. From the herbs point of view, I gave her a modification of Zi Bai Di Huang 1, and she cooked the herbs and she drank it twice a day. We had acupuncture sessions every week, once a week. She didn't feel any vaginal discharge. We started the treatment, the acupuncture treatment, and I chose few points. I will not tell you the whole case because it took a while. It took us a month and a half, even less. I think 1 month, and she got her period again. But what I want you to understand is the way I think. So the frequent points that I used were GMA. GMA is the three sisters, which are on the spleen channel on the thigh. I also chose the three yellows points on the thigh, which are on the liver channel. And I also chose points on the Ren Mai in order to facilitate and regulate the menses. I chose CV12 and CV6, CV10 and CV4. This way, I believe that we can boost the qi from the middle jiao. CV4 is going to nourish the blood and the qi, also the yang. Sometimes I do a stimulation on these points in order to emphasize their effect. Other points that I used were Foucault, and I also like to use the extra meridians in these cases. So I open the Chong Mai. The Chong Mai starts from the lower jiao. Actually, we say it starts between the kidneys. So it can influence the uterus and it can influence the blood flow within the uterus. So I wanted to work on this area, and I wanted to boost her blood. That's why I chose the Chong Mai with the Fuke point. So Chong Mai, Fuke, and GMA are frequently used points in my clinic. The combination of GMA and Chong Mai will emphasize the building of blood around the uterus, around the pelvic area, and also the movement of the blood around this area. So when she took the herbs and the acupuncture sessions, after a while, really it was a very short treatment. I think in less than around one month, the menses appeared, the period appeared, and later on we continue our treatment. And yesterday she told me that again the menses are regular, so around every 26 to 30 days she gets it. This was her third time already. So I believe that we passed this irregular period of time. So even if we see high FSH, in my opinion, when the reason for that is more emotional, I think we have a great impact that we can do. She is 42 or 43 years old, sorry. She is too young to stop the menses. And I think that the menses stopped because it was a very strong emotional effect, and the communication of the Baomai, which is the heart and the kidneys, or we can say from a Western point of view, the pituitary and the ovary, that there was a block. So thank you, and continue to do the good work that you do. Bye.